Okay, good afternoon, folks. This is Juergen again from CSUD. It's spring in Kansas. First time I could wear a short-sleeved shirt. Anyhow, today I want to discuss universal vaccines for influenza virus infections. As we all know, it's always tricky to have a good match between the regular vaccine for influenza and the circulating strains. Why is this? Because the strains for the vaccine, which will be used in fall and winter in the northern hemisphere, will be decided already in February, March, and spring during a meeting in Geneva. And these people who decide who the vaccine strains will be obviously don't have a crystal ball, and sometimes they predict not the correct virus match. And so vaccine efficacy drops if there's a mismatch and people are unhappy with the vaccine for influenza. So what is the solution? The solution is to produce or develop a vaccine which is more universal in its protective activity. And so this concept of universal vaccines is followed by various groups and with various kind of approaches. One approach is using the internal nucleoprotein and matrix protein of influenza. They're highly conserved. Another approach is using the M2 ion channel protein, the ectodomain, which is also highly conserved. And another concept is using a conserved region within the hemagglutinin of influenza. All these three approaches are in clinical trials, and in one of these days, in a couple of years from now, we might have a vaccine which is more universal in nature than the vaccine used right now. We at CSUD, at Kansas State, we follow the concept and do proof of concept studies, which is based on the knowledge that some area within the hemagglutinin of influenza, the so-called HA stock, is highly conserved and can be used as an antigen for immunizations. This work was pioneered by Peter Padez from Mount Sinai School of Medicine in New York, and later on taken on by Florian Kramer also from the Mount Sinai School of Medicine. And what they have shown is that there are two different hemagglutinin groups within the hemagglutinins, and that when you can use the stock domain to protect mice and ferrets is a human-like model for influenza, against different subtypes of influenza virus challenge. So we are using the same concept, using stock peptides or stock area of the hemagglutinin to immunize pigs and then challenge them with pig or swine influenza viruses. And so far we can say this concept is also valid in the pigs. And so the advantage of this vaccine will be that it protects against various subtypes and new genotypes of influenza. So you don't have, if there is a new pandemic coming and the authorities need to produce a new vaccines, which takes 6-8 months before they are on the market, you have a vaccine already in stock which could protect against this future pandemic virus. And so that's the concept of universal vaccine research we do at CSUD. Thank you very much.